For more than 10 years, Partnership for a Healthier America has worked to transform the food landscape in pursuit of health equity. PHA's model of partnership, progress, and passion has resulted in tremendous impact. But as COVID-19 has shown us all, the work of food equity is now more crucial than ever. The pandemic has caused historic disruption and devastation, but has also brought insight and clarity. One glaring truth it has exposed is gross disparities in access to healthy food for many Americans, particularly in economically disadvantaged and minority communities. PHA's COVID-19 Fresh Food Fund has provided more than 2 million servings of nourishing, high-quality fruits and veggies to families in need now, while creating a platform to raise awareness of the need for long-term changes to the food system in pursuit of health equity. Since 2016, the Partnership for a Healthier America has recognized, elevated, and accelerated the work of food banks and large-scale food pantries across the country that are uplifting the health and well-being of their communities. PHA's 28 food bank partners reach more than 7 million food-insecure individuals across 19 states and have increased the amount of healthy food distributed by 115 million pounds, while eliminating 19 million pounds of junk snack food from their inventories. Through its Veggies Early and Often campaign, PHA is convening food brands, early childhood educators, and more with the goal of raising a generation of veggie lovers. The early years of a child's life between 0 and 2 are a unique window to cultivate healthy taste preferences and dietary patterns. The key to cultivating these healthy taste preferences? Exposure to vegetables, early and often. From warehouse to checkout, PHA's distributor, grocery, convenience store, and vending partners are improving the supply chain so that better-for-you foods and beverages are available wherever people are. Through our retail partners, PHA is delivering sustainable solutions to the issue of health inequity by ensuring affordable, nutritious food exists in every community.
Well, hi there.
Oh, hi.
Who are you two?
I'm Waffles, and this is Mochi.
Well, hello, Waffles and Mochi.
Hi.
I am Mrs. Obama.
I want to tell you about something I'm working on along with my friends Waffles and Mochi. On our new show on Netflix, Waffles and Mochi take us on all sorts of adventures around the world. And now we want to take your family on even more adventures through our Pass the Love campaign, with recipes and activities that will make you laugh, help you learn, and of course, fill you up with delicious food. And that's why Waffles and Mochi are teaming up with a Partnership for a Healthier America to provide more than 1 million meals for families in need. With your help, we'll pass the love with fresh, delicious meals that are quick and easy to cook together at home. We want to make sure that no matter where you live or how tight your budget, you can access good food for your family. Because we want everyone to join Waffles and Mochi on their amazing journeys.
Listen to your vegetables! Feeding your parents!
Hey everyone, I'm Tommy McFly in Washington, a correspondent for NBC4 and host on Real Fun DC. Thank you so much for being here. I am so thrilled to welcome you to this year's Partnership for a Healthier America Virtual Summit. We've got quite the adventure for you ahead over the next 2 hours. You're going to be seeing and hearing a lot about and from our friends Waffles and Mochi during today's program. Just this morning, as a matter of fact, super cool. Netflix shared some exciting news. They're putting the very first episode of Waffles and Mochi, Tomatoes, available for free now on Netflix Junior's YouTube channel. So check it out and tell your friends who might not yet have access to Netflix that they can see Waffles and Mochi's first episode, Tomato. And I will tell you, as someone who's 34, I learned about tomatoes from that very first episode. Plus, for the DC people in the room, Chef Jose Andres, the one and only, makes a cameo in that as well. So absolutely fun to check it out. Got a little bit of housekeeping for you today as well. Closed captioning is available for this program. Look for the closed captioning icon right in the bottom right corner of the box that I'm in right now. All right, let's get started. I would like to bring in and introduce the president and CEO of Partnership for a Healthier America, Nancy Roman. How you doing, Nancy? Good afternoon.
Great, Tommy. Great to see you. Thanks for doing this. Thanks for being here.
Thanks for having me.
Yeah, well, it's great to see you and it's great to see everyone. I'm Nancy, President and CEO of Partnership for a Healthier America. Welcome to PHA's 2021 Summit, and thank you so much for being here. There has simply never been a more exciting time to be at the nexus of food and health. While the global pandemic has been tragic for so many, it's also shed glaring light on the unacceptable disparities in food access across the United States and around our world. After the 2020 we all shared, we know that we can no longer accept inequity in general or in our food. We have what I call the burden of knowledge. We know that lack of good food means not just diminished quality of life, but increased chance of death, both from COVID, as we've seen, but from other chronic diseases like diabetes, heart disease, and even cancer. PHA is now working to bring better, more innovative food options to families in long disadvantaged communities. Our goal is sustained, affordable access to high quality food. We will never have health equity in the United States without food equity. And we will never have food equity unless public health, government, and business do something tomorrow that we're not doing today. That spirit of partnership, innovation, and impact brings us here today under the theme Pass the Love. And after such a trying year, it's a welcome approach. Through the Pass the Love campaign, we're providing meals to families and cities with the highest rates of child poverty. And we're doing it in tandem with a brilliant and funny Netflix show called Waffles Mochi and starring Waffles Mochi. Michelle Obama, our honorary chair, has been such a big part of the show, of course, and the campaign. You may have seen her on Ellen, The Daily Show, or The Today Show, and hopefully in her role in Waffles Mochi. She and we and Higher Ground Productions and our amazing partners, Walmart and Blue Apron, hope to inspire young parents and their children to explore food, to discover ingredients, and just to have fun preparing meals together at home. In the public health community, we've been slow to appreciate the pure joy of food as a means to better eating and better health. So this is our chance. You'll hear more shortly about this critical work, and you'll get a chance to see what makes PHA special and why our mission is so relevant. From food bank executives to CEOs, we've convened important voices to elevate big ideas and necessary conversations about our food landscape. Now, all of our work and everybody listening here today has been impacted in some way, shape, or form by this pandemic. Last year, we came to you at this summit during the early days of the pandemic. We had just launched our COVID-19 Fresh Food Program, which brings fresh produce straight to those who need it for 12 weeks in a row. So they not only get fruits and vegetables, but get them long enough to build a lasting habit. Since then, we've distributed more than 2 million servings. And we're collecting data showing that those who receive this high quality produce for 3 months straight are willing to pay for it if they can get it. So we'll be expanding this program, challenging food retailers and entrepreneurs to step in and sell good and affordable produce where it's most needed. Sustainability is everything. Over the last year, we've seen, as my friend Barry Mazafarian has deemed it, a fast pandemic on top of a slow pandemic. COVID-19 on top of diabetes and heart disease and even food-related cancers. COVID has brought tremendous clarity to all of us who work around food, health, and nutrition. Many at long last recognize that while food has the ability to build health, so often it diminishes it and sometimes destroys it. We can change that. We are changing that, and we need you to help us make change faster. I hope that you leave today's conversation with a better sense of why I wake up every day and energized and pumped about the work and impact of PHA. Please know that you can be part of it, either through direct partnership, by donating, which is so critically important, or simply by helping us disseminate the messages necessary to drive change. For those of you who've been with us for years, I want to say thank you. Your support really matters. And then for those we're just meeting today, welcome. We really need you as part of our movement towards better food for all. Now, I'm going to be back with you a little later during the program for a conversation with our honorary chair, Michelle Obama. She was just great. We had a good time. But now I'd like to turn it over to her to welcome you, the inspirational First Lady and PHA's honorary chair, Michelle Obama.
Thank you, Nancy, and hello, everyone. First, I just want to say thank you to all of you for joining this year's Partnership for a Healthier America virtual summit. I am excited to be here to not only celebrate another year's worth of progress and impact, but also to emphasize the important role that our food systems play in building a healthier, more equitable future. Look, it has been a long year, and we have all felt it. But it's no secret that the pandemic has been far tougher on some people than others, especially when it comes to health and hunger. So it couldn't be more clear that addressing these widening gaps in America means addressing the inequities that persist when it comes to affordable, nutritious food. And let's be clear, everyone in this country, in every community, deserves access to healthy, affordable meals. And while this past year has made it clear that we've got a lot of work to do, it's up to us to make sure that work actually gets done. Because if we don't do it, who will? That's the urgency that helped drive us to create the Pass the Love campaign. It's an effort inspired by our new Netflix show, Waffles Mochi. And while the show features a magical flying shopping cart and a hybrid creature that's part waffle and part Yeti, what's happening in this campaign couldn't be more real. Through Pass the Love, we hope to inspire families to explore new ingredients and recipes at home, just like Waffles and Mochi do on their adventures. But we also want to go further. We want to raise awareness about food equity. So we're raising funds to distribute 1 million meals to families in need through meal kits inspired by the show. We couldn't do this work without our partners. And so I'm especially grateful for the support of Walmart and Blue Apron, because not only are these companies bringing the joy of Waffles and Mochi to their customers, they're also helping us raise the money we need to meet our goal. We're also thankful for the generous support of so many others, including companies like Bounty and Birdseye. And I hope you'll all join as well. You can donate right now at wafflesandmochi.org. And I hope you'll spread the word about passing the love to everyone you know. This campaign couldn't be closer to my heart. And that's why when we wanted to make a difference, I knew we had to team up with the Partnership for a Healthier America. From spurring global dialogues on food and nutrition, to working with retailers to improve our nation's food supply, to spreading the word about the importance of veggies for baby and toddler foods, you all have been leading the way on these efforts for so long. But I know you're nowhere close to being satisfied. You're always out there thinking about the role you can play in supporting families and transforming lives. So if you're out there wondering how you can help, you've come to the right place. I hope you'll settle in for a taste of what this terrific organization is up to, and then I hope you'll team up with us in the months and years ahead. So have a great summit, everyone, and I will see you later on.
Thank you so much, Mrs. Obama. So great to see you. Definitely a career highlight of me, maybe a life highlight of mine, was being the very first ever MC of the White House Easter egg roll. What an excellent assignment. I still have the eggs, as a matter of fact. They've been in my Zoom shots this whole time. It was absolutely incredible, and I'm so grateful to Mrs. Obama and her team for inviting me to be the first MC in American history. Definitely a career highlight. And special thanks to Waffles and Mochi for all of the food puns today. Pretty excited about all of those. Speaking of Waffles and Mochi, their food adventures show not just fun for the whole family, but together with PHA, it has a special purpose, bringing healthy food to families in need. Here at PHA, we call it Pass the Love. Later on in the program, Nancy Roman and Michelle Obama will have a one-on-one sit-down conversation about Pass the Love, that campaign, about food equity, about the work of PHA, so stay tuned. That is coming up in just a little bit. But next, a few of our PHA board members will introduce you to our Pass the Love inaugural partners, Walmart and Blue Apron.
Hi, everybody. My name is Jason Langhire. I'm the CEO and founder of Food Smart, a nutrition organization that helps with support health equity around the United States. I grew up on food stamps myself, and I couldn't be more appreciative of what Warren is doing at Walmart. We're very lucky to have Warren Moore here, who is a pharmacist, but leads a series of initiatives at Walmart around driving health equity in a way that only Walmart could potentially do. And we're really honored to have Warren and Walmart partnered with Partnership for a Healthy America, where I'm a board director. To kick right in, Warren, I was actually wanting to start on more of the personal side, like where are you from and how did you get into this journey of the work that you're doing on health equity at Walmart?
Hey, Jason, nice to be with you today, and thanks for the kind words. You know, we're at Walmart, we like to pride ourselves on getting things done, and so this is a complex issue that we're trying to take care of as we get into it, talk around whether it's food security or nutrition security, and so we're trying to handle that complexity with the right speed in order to have the right impact. I tell people though, I'm born and raised in the 901 area code and the 38109 zip code. And I tell people that for those not familiar, 901 is Memphis, Tennessee, and 38109 is an area called Westwood. And as I've gotten into this work and I think about the challenges that face a lot in Memphis, I looked at the life expectancy gap. And the life expectancy, if I lived in Westwood, would be 70 years old. So you would know that that's less than the national average. But the story really is if you drove 30 minutes down the highway to a town called Collierville, I would be expected to live some 11 to 13 years longer. And so those stories don't play out just in Memphis, they play out in Chicago and Detroit. And some of them you see 20 to 25 year gaps. And I tell people, if I lost 11 years off my life, that's 11 years less with my family. That's 11 years less with contribution to society, to my community. And so, you know, as I got into this work, I'm a pharmacist, as you said, by training, and now having the opportunity to lead our health equity work at Walmart. It's those type of connections back to growing up, back to the community that I still love today, and having an opportunity to make an impact that can be a lasting one.
Yeah, that really resonates with me, and I so appreciate what you're doing, because I grew up down the road from a Walmart outside of Buffalo, and I grew up on food stamps and free lunches. But now it seems like you and Partnership for Healthy America, Higher Ground, and Mrs. Obama have really kind of come across something that's hit a nerve with Waffles and Mochi on Netflix with the community. But the real question now is, like, how do we translate that excitement about those characters, Waffles and Mochi, and what they teach kids about food to action? And what are the things that you're doing at Walmart in this collaboration?
Yeah, I'll take it a couple ways. So we'll talk about kind of food in general, right? So we know that there's this I would say movement or this recognition that food is medicine. And so one of the things we're trying to do, we know that when there's lack of food every day, so when a person doesn't have enough food to go through the day, or there's poor nutrition options, what we see is that lack of security in food leads to poor choices that leads to a lot of the chronic conditions that we see that plague many minority communities across the U.S. And so as we look to try to take on this work that we're doing around food and nutrition security, we have this goal in mind that we want to help provide all people the opportunity to make food choices that allow them to live a long, healthy life, regardless of income, race, and ethnicity. And so that's a big challenge. We know that there's an access challenge to that, where if you don't have access to fresh foods and vegetables, or you have access to too many unhealthy foods and vegetables, how can we use our business innovation? How can we use our grant investments to really help in communities that have these challenges? You know, when you think about price and value, so there's a switching cost a lot of time from people going from healthy to unhealthy to healthier items. And so is there ways that we can reduce that gap in the switching costs and still provide the quantities that people need to feed their family? And then there's this notion around experience. We believe that there's this cultural experience that can be created around food, and it should stay within food. So as we move people to try to make healthier choices, how do we do it in a culturally sensitive way? Engage parents and kids early on to shape taste profiles and to do that. And so this partnership or collaboration, I said, that we have with Partnership for Healthy America and First Lady Michelle Obama, this around the hidden world of waffles and mochi gives us this way to have experience, for kids to experience, for parents and kids to cook and interact together, whether it's through games, whether it's through learning experience around nutritious foods. I'll say this, I think with this initiative, there are 3 F's, and follow me on this one, Jason. There's food, okay? There's fun, and then there's philanthropy. And I know that last one doesn't have an F in it, but I like to say that. So there's 3 F's though. We'll go with that for today. And so, with this, you can go onto the Walmart.com website. So Walmart.com/waffles and mochi. You can play games, you can watch clips from the shows, you can explore recipes, all centered around nutritious foods. And again, it's a great way for moms and dads, so parents and kids to learn to play and cook together, and then all while helping families in need. So it's a great initiative for sure.
That's right on. It's really cool you guys are doing that. And I love the food, fun, philanthropy. I think at PHA, they spell everything PH. So that's pretty awesome. Can you tell us a little bit more about the experience and how do families and kids kind of give back through the hidden world of waffles and mochi?
Yeah, just like in the show, when kids actually master an ingredient by completing an activity, they'll receive a badge, and that badge unlocks donations from Walmart. So kids can actually unlock up to $1 million from Walmart through the end of May. So kids get busy. And in addition, we're gonna allow customers when they check out to be able to actually round up to the nearest dollar. And that money will also go to the Pass the Love campaign through May 31st. So a couple ways to give back. Again, you can get, it's fun, it's engaging. You can learn something along the way, experience with it, and then also help families in need. So it's a great way, win-win for everybody.
as a PHA board member, I can't thank you enough. I want to thank you again. Are there any closing thoughts you want to share with the audience here today about all the work that's happening and about the Hidden World?
I think just, again, excited about what it can bring to bring families together, moms and dad, kids, around the table, doing things that could be sustainable and having a healthy life outside of the healthier options. And then just really excited this month of May. Let's unlock some badges. Let's make sure we round up at the registers, and let's help families in need.
Thank you, Warren. Can't thank you and Walmart enough for your partnership with PHA. Everyone, please check out Waffles and Mochi. You'll love the show. And I'm going to pass it over to the Walmart team for a brief message about the hidden world of Waffles and Mochi. Thanks, everybody.
Hey, want to hear something cool? Waffles and Mochi isn't just on Netflix. Unlock the hidden world of Waffles and Mochi in the Walmart grocery department. Your phone is a portal to an awesome world of adventure where families play together, shop together, and cook together. Each food unlocks more games, recipes, stories, and clips from the new Netflix show Waffles and Mochi. And everything you do unlocks special badges that trigger donations to the Partnership for a Healthier America. Can you get them all? Smash the tater, crack an egg mystery, make silly pickled animals, and way more at walmart.com/wafflesandmochi.
Hey, Mochi, I'm kind of thirsty. I bet everyone else out there is too. Ooh, think we should tell them to take a quick drink break? Hey, everyone, drink some water and stay hydrated. Us too, Mochi. Drink your water. Much better. Stay hydrated, everyone.
Hello, everyone, and welcome. I am Imani Green. I'm the president of Green Group, and I am a very, very proud PHA board member. I'm delighted to be joined in conversation today by Linda Finley-Kozlowski, president and CEO of Blue Apron. Blue Apron, as you may know, is one of two very integral partners of PHA's Pass the Love campaign, something we're incredibly proud about. And today we're going to learn a little bit more about why efforts like Pass the Love are so critical to Blue Apron and their work. Linda, thank you so much for joining us. It's really a pleasure to have you.
Thank you so much for having me. I'm delighted to be here and so thrilled to be a part of this campaign.
So I've got to know, first off, what attracted Blue Apron to Pass the Love? What is it about it that makes it feel like it's important to the inherent complexity of your brand?
Honestly, the Pass the Love campaign is just perfectly aligned with our vision, which is better living through better food. And we believe it's our responsibility to help make this possible for everyone. It lets us use our culinary authority to help implement systemic change and promote food equity across all areas of our business and how we think about our relationships to the community. We talk a lot about making good food accessible to everyone, and this partnership really lets us take advantage of the efforts we have on our side to provide that access, but also just magnified by the work with Partnership for a Healthy America.
So can you talk a little bit more, Linda, about healthy food? I mean, I think that's where we intersect. That's where our brands grow and connect and blossom. Can you talk a little bit more about what healthy food is to Blue Apron and how you think that that PHA and Pass the Love can help bring that to people through Blue Apron?
Yeah, no, I actually think that that's such a great connection here, is that healthy food, I think, often has been thought of something that's either restrictive or unattainable or overly expensive. And the reality is it doesn't need to be. And that's a big part of where we've focused as a company in general. And for us, it's about how do we actually continue that message. So for us, we think about healthy food sort of in two different categories. We think about the food itself, which is high quality ingredients that are whole ingredients. So we've developed a direct supply chain that lets us source mostly directly from the producers very high quality ingredients And that reduces food waste. Food waste is one of the biggest contributors to increasing costs of ingredients that makes them less accessible to other people. By reducing food waste and doing direct sourcing, we can get the highest quality ingredients at the best price, and then use that to help leverage and scale. So I think that's one aspect of healthy eating, is really starting with whole ingredients and removing that intimidation behind cooking, or the planning process, or the waste, or the sort of perception that cooking is hard or difficult. Like, let's make it easier, let's give you great ingredients, and let's reduce the waste so that we can save you money. That's one side. The other side of healthy to us is about that actual act of cooking and connecting with your family and friends while you're doing it. So there's lots of research that shows that community is so important, and teaching skills and accomplishment and empowerment is so important as part of the process too. And what's more empowering than creating a meal together as a family, teaching your kids how to cook, and getting that feeling of satisfaction of taking those whole ingredients and turning them into something amazing. So when we think about healthy foods overall, we're not thinking about restriction, we're not thinking about diets, we're thinking about empowerment, great ingredients, great skill sets, and really combining those things to create something that is actually quite accessible to a lot of different people.
One of the things that I know is really important to both of us is the sort of affordability of food for people. Affordability across the board, right? Because it's not just about what you can eat today and what you can afford today, but it's about creating a lifestyle for generations to come. How would you envision that something like this could grow to have sort of a long-standing benefit over time to communities of varying different of economic levels?
Yeah, I think you're so right about the cultural connection of food. And I think people often think about that cultural connection of gathering around a table, whether it's family or friends, or, just a couple, how many relationships have blossomed over just a conversation over dinner. And cultural connections to food, I think, are extremely important, and they're very visceral for everyone. But the accessibility of that connection is really what we're trying to empower here. By using technology to actually automate and reduce waste and make those more stressful parts of the meal planning process easier, then you actually free people up to be able to focus more on that connection part over food. And I think one of the more interesting things that we've seen in the meal kit space is we have so many customers that started cooking with their families, and now their kids are cooking for them. So one of the biggest pressures that families feel is this idea of, I don't have enough time. I have too many things I have to do, particularly if you're working multiple jobs. It's less about the ingredients sometimes, and it's more about that accessibility of time. And if you're able to empower your entire family to help cook, including your kids, then that multiplies the time that's available to help bring the family together. And that can really pay off dividends long-term in the future, to be able to take those ingredients that are affordable but quality, and take the reduction of stress in the planning and preparation process, and really create some great magic.
Okay, so let's talk about magic, right? And those funky little critters that you just mentioned, kids. At the end of the day, this only really works and becomes like a generational product if it tastes good. Because no matter how healthy it is, and no matter how we dress it up, historically, people tend to want to put butter and salt and cheese on things to make them taste great and to get them down their kids' throats. So how do you propose that? How does Blue Apron solve for that? And I'd also be interested to know if that works in your house as well.
So Blue Apron actually solves for this incredibly well, in the idea that we have something called the Blue Apron Plus One. So our team of culinary experts think about not just the individual ingredients, but the interaction between those ingredients. So, and salt is actually a really good example. So a bit of salt isn't just about seasoning, but it also sometimes changes the chemical reaction of the food as it's cooking. And so how those dynamics work together really changes the flavor of the food, even if you're only using a little bit of it. And so that +1 is something that we focus on, because it's like, how can we just take that one more level and up a notch? because I completely agree with you. And this goes back to the question about health. It doesn't matter how healthy something is. If people aren't going to eat it, then if they don't enjoy it, then it's not going to be healthy to them because they're not actually going to be ingesting it. So it needs to taste amazing. And we have all sorts of tricks up our sleeve after 5,000 recipes that we've created over the existence of the company to really know how all those different aspects of a recipe work together to create that flavor. Roasting a vegetable, for example, instead of actually cooking it on the stovetop can completely change the flavor, bring out the sweetness of carrots, and then kids all of a sudden love it.
Well, Linda, I'm super grateful to have you here. I'd like to announce on record that PHA is perfectly willing to be a Blue Apron and learn under you all for as long as you will have us. Thank you so much for your time. Thank you for your partnership. Tremendous things for your support. And I think at this point, I'll turn it over to a brief message from Blue Apron for everyone to enjoy. So stay tuned.
Wondering what's for dinner? At Blue Apron, variety is always on the menu, featuring premium meals, options for a healthy lifestyle, meat lover favorites, and vegetarian dishes. We keep dinner interesting and keep you inspired. With 30 weekly recipes, learn new things, try new tastes, and refresh your routine. Skip the store, skip the stress. When it comes to quick and easy meals, Blue Apron delivers straight to your door. We're excited to support Partnership for a Healthier America's Pass the Love with Waffles and Mochi campaign.
The Pass the Love campaign has a global goal of distributing 1 million meals to families in need. And like Waffles and Mochi said, we need your help. Click the donate button right on the screen, or you can give whatever you can. We so appreciate it at wafflesandmochi.org to support the work of PHA today. Pass the Love meal kits are being distributed in communities around the country. As a matter of fact, PHA announced this summer Atlanta and Cleveland will be the first communities receiving these meal kits. Each box contains all the ingredients you need to make 3 recipes inspired by Waffles and Mochi. Just so happens that we shipped one of those boxes to our friends Waffles and Mochi at Mrs. O's store. Let's take a look and see what they thought of these boxes.
Oh, hey, Moch. Whoa, what's in the box? Oh, no way. It's a Pass the Love box? And look, it even has our faces on it. Cool. Oh, I wonder what's inside. Oh, yeah. Let's open it. Come on, Moch. Whoa, Mochi. Look at all these amazing ingredients. Hey, what's that? Oh. What? Sweet potato black bean stew? Oh, I love sweet potatoes. Oh, we learned all about them in Peru, remember? So you mean this box has everything we need to make the whole recipe? Yeah. Wow. Well, what goes in it? Chipotle, black beans, and sweet potato. All sorts of spices. Ooh, we love spices. Yes, we do. Tomatoes. Ooh, we know all about tomatoes. Wow, this makes it so easy. We can make this whole delicious meal together, and it has everything we need. Wow. I'm so happy we get to help people cook at home through the Pass the Love campaign. Mochi and I have always wanted to be chefs, huh, Mochi? And we know that every family wants to cook fun, healthy meals at home just like these. But Mrs. O taught us that not everyone can afford these wonderful things. We want to pass the love to as many families around the country as we can. But we need your help. That's right, Moch. You can go to wafflesandmochi.org, where you can make your own recipes and find out how you can help pass the love to families in need. Hey, Moch, you know what we can do now? Yeah, we can make dinner for all our friends at the store. I think Mrs. Zoe is going to love it. Let's get cooking.
I'm Jeff Mills, the CEO of Genuine Foods, a food service company delivering high quality and culturally relevant food to schools, institutions, and communities across the country. We are so proud to be a part of the Pass the Love campaign, helping to assemble and prepare the meal kits that you just saw from Waffles and Mochi. At Genuine Foods, we emphasize cooking fresh ingredients, regional supplier relationships, and meals that celebrate local cultures and communities. Genuine Foods aims to improve the lives and livelihoods of people and communities so that all of their members can flourish. When we were approached by PHA to support the Pass the Love campaign in collaboration with Michelle Obama, we were honored to join them in inspiring families around the country to explore the joy of cooking affordable, nutrition-forward, and fun-at-home meals. The Pass the Love campaign is perfectly aligned with Genuine Foods' purpose to ensure that every child, every person has access to high-quality meals that taste good and fuel and comfort them throughout the day. In our role, Genuine Foods has developed meal kits with simple, affordable recipes, sourced whole food ingredients for those kits, and is working with PHA on their multi-city distribution. Our chef, Amy Yee, developed delicious and easy to make recipes for each Pass the Love meal kit, highlighting ingredients featured in Waffles Mochi. We hope every meal kit will engage children and families in the cooking process and provide families with recipes that can be affordably replicated. Our team has also sourced high quality ingredients such as whole wheat pasta, brown rice, red lentils, and fresh produce. Through this collective effort, we aim to provide 1 million meals to people across the country. I founded Genuine Foods with the goal of making fresh, scratch-made food accessible to all. As the former director of food nutrition services for DC Public Schools, it was my responsibility to ensure that nearly 50,000 students at 120 plus schools every day received high quality meals. It has always been my mission to provide kids and families with healthy meals throughout the day, every day. With the Pass the Love campaign, we're able to nourish kids, not just in school cafeterias, but in their own homes. We are playing an important role in supporting more families by removing the barrier of time and access to fostering a lifelong joy of cooking and eating whole foods. Genuine Foods sees this as an amazing jumping off point and an opportunity for a continued partnership that reshapes the narrative around food access. We believe in the power of food to transform lives and livelihoods, and we hope all participating families and communities are able to feel the power of real, genuine food. Through our partnership with PHA and the Pass the Love campaign, we see the opportunity to create a movement that prioritizes access to high quality, nutritious food, regardless of location. Meal kits reflect a shifting trend in making fresh and affordable produce easily available to communities across the country. And they provide a way for families to connect in the kitchen over cooking, to taste new and familiar ingredients, and to learn new recipes that can become a part of a family's recipe book for generations. We're excited to bring a love of cooking to even more people. Join us and PHA as we continue to find ways of bringing healthy and affordable meals to communities across the country. Thank you.
Thank you very much. And if you'd like to support PHA's efforts to bring healthy meal kits to families around the country through the Pass the Love campaign, just visit wafflesinmochi.org and donate today. We'd really appreciate anything you can do. PHA works with dozens of food banks all around the country, working to improve the nutritional quality of food for those who rely on the charitable food system. The pandemic has highlighted how important these institutions truly are in our communities. Now I'd like to introduce to you PHA board member, Dr. Jide Williams, for a conversation with a few of the food bank leaders that PHA is so proud to be partnered with. Dr. Williams, good afternoon. Welcome.
Hi, how are you doing? It's great to be here.
It's great to have you with us, and thanks for this conversation you're about to have.
Thank you. Thank you. So I just want to, again, it's a pleasure to be here. I'm Dr. Jide Williams. I'm an Associate Dean of Community Research and a professor at Columbia University here in New York City. I'm a proud member of PHA's Board of Directors. I'm very pleased to be here with you today to talk about PHA's work with food banks and food pantries through the Healthy Hunger Relief Program. 42 million people in the United States face hunger. And that number may be even higher today due to this pandemic. Food banks and food pantries play a key role in meeting the nutritional needs of those who lack access to nutritious and affordable foods. Since 2016, Partnership for a Healthier America has recognized, elevated, accelerated the work of food banks and large-scale food pantries across the country that are uplifting the health and well-being of their communities. PHA's Healthy Hunger Relief Partners play a critical role in ensuring that communities and families have access to healthier, nutritious foods at times when they might otherwise have to go without it. These partners have reached more than 7 million food insecure individuals across 19 states and have increased the amount of healthy food distributed by 115 million pounds, while eliminating 19 million pounds of junk and snack food from their inventories. I'd like to introduce you to two of our partners in this effort. Sophia Linares-Coy, Executive Director of the Food Group Minnesota, and Brian Green, CEO of the Houston Food Bank. Welcome, Sophia. Welcome, Brian. We're so glad you're here. So I'd like to spend our time together exploring your work with PHA, the challenges your organization has faced during the COVID-19 pandemic, and what opportunities lie ahead for food banks and food pantries. And so we'll just get right in. And I just want to begin by asking both of you to share a little bit about your organizations and the communities that you serve. Sophia?
Yeah, thank you so much. It's such an honor to be here today with all of you. So the Food Group Minnesota, we are a nonprofit food equity organization, and we really work across the food system from production to distribution. So we have a land-based education program where we train immigrant and refugee farmers. We also have affordable grocery programs that focus on bringing nutritious foods to areas that don't have good access to groceries. But today I'm here to talk more about our hunger relief work. And so we work with over 200 partners in the Twin Cities metropolitan area in Minnesota. And we really focus on making sure that the food that we provide to our partners is nutritious. We also have values of making sure our food is culturally connected and are doing a lot to increase the amount of local food that we're distributing to our partners. So the community we serve is diverse and getting more and more diverse. We're really focused on ensuring that the hunger relief system reflects the participants and really includes more community voice. And thinking a lot about how we think through how to create welcoming spaces that are really dignified and promote nutrition, but in a way that crosses culture and feels really accessible to folks who are struggling to make ends meet.
Thanks for that, Sophia. And over to you, Brian. Can you tell us a little bit about the Houston Food Bank and the community that you serve?
Sure. So Houston Food Bank is one of the 200 Feeding America food banks. We're independent organizations to serve our community, but we cooperate together both on the standards that we'll do and also sourcing the product. So the people that we serve, our target group is a food insecure population. Food insecurity isn't necessarily hunger. It's the greater set. So these are families that they're struggling to have enough resources for a healthy diet consistently. So usually it's around 13% of the population is food insecure, and about 5% of that population is actually experiences hunger. So it's nutritional compromises are the most likely impact of food insecurity rather than hunger, which is different than we used to think. Food banks were formed to try and go get the surplus food. There's a huge amount of food waste, estimated about 40% of food supply in the United States never hits the stomach. To get that and channel it to people in need. In the early days of food banking, quite frankly, that food had a heavy ratio of not nutritious. It was snack foods and code-dated type items were generally the easiest things for us to get very good green products. We are not your grandmother's food banks anymore. Like in our case, 40% of our distribution in Houston is fresh produce. That's becoming fairly common in food banks. There are many food banks that are well above 50% of our distribution is actually fresh produce. And this is where Partnership for Healthier America is actually a very good fit for us, because as we're looking at the outcomes for the people that we serve, it isn't just about trying to stave off hunger. It's about how their lives are going and the consequences of what they eat.
That's really wonderful. Thank you, both of you. You know, it's interesting you mentioned nutritional compromises and its impact on health. And we know We know that today that given the COVID pandemic, these diet-related diseases have had such an accelerating effect on severe COVID. But on this note, how has your partnership with PHA accelerated the work that you're doing in uplifting the health of your constituents, Sophia?
Yeah, so what I so appreciate is that PHA is really helping advance the national dialogue around nutrition. So the food group, I can remember we got a dietitian on our board probably 14 years ago, and there was a debate in our boardroom around, is it any food is good food to give to people, a lot like Brian was saying, or does it really matter about the nutritional quality? And we established a healthy foods policy then, and it was risky. It was controversial. We started turning down donations, and in the food baking space, that is a risky proposition. But what I so appreciate is thanks to leaders like PHA and many of you on this call, we've come so far in the dialogue around understanding the link between food insecurity and poor health outcomes, understanding how that is not good for our society, that we need kids to have the nutrition that they need to grow and thrive in society. And so it really matters what food is distributed when folks are going to a food pantry and needing that assistance. So what I really appreciate is so often in food banking, we're in this position where we're seeing the results of a food system that has not been designed to work equitably for everyone. And we're trying to fill the gaps as best we can. But what I really appreciate about PHA is it's about developing the relationships with people beyond our charitable food work, right? With food producers and manufacturers, with decision makers and policy makers. How can we make a system that actually works better for people? How can we make a system that has health equity as a core tenet? And that's why, we're so honored to be a partner with PHA in that work.
Thanks, Sophia. We are so proud of this initiative at PHA. It's really one of the initiatives that all board members like myself are really, really passionate about. And so it's great to learn insights directly from you and share those with our audience. And so to you, the same question, Brian, how is working with PHA really accelerated your work and really focusing on the health of your constituents?
Well, it actually goes beyond that. It's really the direction we want to go anyway, and the leadership of PHA is very helpful in this. You think about in your work, Doctor, social determinants of health are becoming recognized as, have bigger impact than the medical care itself on the health of America. And food banks have just come to realize the role that we should be playing, not just in our own distribution, but in our interface with health organizations, healthcare organizations. It's like, okay, when people are struggling with health issues, so often it's a result of other issues in their life, and diet is one of the biggest of them all there. And this is where we find that we actually can be very helpful. As I said, we're getting to be close to 50% of our total distribution across the network being fresh produce. Wow, this, to the extent that you're targeting this to populations that most are in need of a healthier diet, we can actually change consequences that you're experiencing in your own work. And this is the sort of interface that Partnership for Healthy America facilitates.
Yeah, it's so exciting. It's interesting that I think more people now, because of some of the work that we've seen during this pandemic, within the pandemic, have really appreciate the effect that social determinants have on the lives of people, especially the most vulnerable around us. And food deserts and the quality of your food and the diet-related diseases that emerge, you put folks at risk for all kinds of things, even beyond severe COVID. But you guys must have also experienced real challenges during this pandemic, and I'm just curious to learn a little bit more from both of you what some of these challenges your organization faced during the pandemic. Sophia, quickly, and then over to Brian.
Yeah, so a lot about how hunger relief has been done is it's very volunteer-based, and it's about bringing lots of groups of people together to pack food and distribute food. So a lot had to change quickly. One thing was clear when the COVID lockdown started to go into effect, it was clear that hunger relief was indeed an essential service. And, I was able to really take heart in that too, to have our staff and our volunteers see how important this work is. And so we had to find a way to continue to do it. Obviously, we had to keep people safe. So keeping participants and volunteers and staff safe was key. It meant changing a lot of our programming. So that part was real. And we had to do a lot of innovation. And for us in Minneapolis, that innovation just had to keep continuing, because then as we moved into the summer, we had the murder of George Floyd in our local community, and a lot of conversations about race and racial unrest that was a crisis within a crisis when it came to food access. So it's been a lot of innovative expansion of our partnership, thinking about food distributions in different ways. And for us, really making sure we follow community lead, because it's community members who are struggling who know how they want to access food. And it's our job to be as nimble as possible and respond to those requests.
Absolutely. And Brian, can you tell us some of your challenges over the last year?
Yeah, a couple of issues. First off, it was amazing how the lines went crazy long right away, because the pandemic impacted lower income families more than anybody else. We've had hurricanes down here. Hurricanes hit everybody. It's worse for low income families. The pandemic, the economic consequences, 80% of the job losses happened to the bottom 25% of the income families. So the lines went crazy long. But then supply, how are we going to get food to do this? But that's where, when the restaurants closed down, what was going to be sold to the restaurants had nowhere to go. And that became resources for us. And it was kind of a unfortunate nice thing is like how we were able to get actually even more fruits and vegetables than we otherwise could. Because you think about what was on a restaurant plate, so much of the vegetables or the fruits that were there, it became resources for us. And we're able to get to its families. In many cases, those very same workers who were working in the restaurant, and now that's that food that restaurant would have served. It was just trying to piece everything together as every day went by. What did we get in yesterday? Just keep it going. Eventually that got us to where we are today. This feels like almost like a normal to us.
Well, I can't thank both of you enough, Brian, Sophia, for being here with us today and really sharing this important work. Your commitment to serving the most vulnerable among us is really she deserves utmost applaud and appreciation. The program will continue after a quick message from our Pass the Love supporter, Bounty. Thank you.
Nope. Nope.
Come on, him?
Ooh, I like him.
Quick, the quicker picker-upper. Bounty picks up messes quicker, and each sheet is 2 times more absorbent, so you can use less. He's an 8.
He's a 9.
Bounty, the quicker picker-upper.
We all know how important it is to eat our veggies, but how can we make those veggies fun and exciting for the littlest eaters? Dr. Kari Cartwright is here with us today from the University of Georgia to tell us all about how PHA's campaign that is aiming to create a generation of veggie lovers. Following, you'll hear from PHA partner Ahold Delhaize about their work in improving the nutritional quality and transparency around what's sold in their stores around the country. So if you're a Giant, Stop and Shop, or Food Lion customer, you're definitely going to want to listen closely to this.
I said I'm eating good in the neighborhood and making healthy choices like I know I should. I gotta cut the fat so I can do my body good, so I can be eating fruits and veggies like I know I should. I know eating 5 a day is the key. Hey yo, I'm just doing what's best for me. I'm just doing what's best for me. Hello everyone, I am Dr. Kari Cartwright. I'm a public health researcher and registered dietitian. I direct the Childhood Obesity Prevention Laboratory at the University of Georgia. My favorite role is being a wife and a mom to my 3 darling daughters, Kamara, Camille, and Cameron. Being a mom is a huge part of why I'm so passionate about promoting veggies early and often to young children. We all want our little ones to be healthy, and introducing them to veggies early and often helps them to build a strong foundation for eating healthy meals throughout life. Despite vegetables being absolutely critical to a healthy life, many infants and toddlers don't eat nearly enough of them. Research shows that even though children are born with an innate likeness for sweetness and a distaste for bitterness, children's taste preferences are malleable, and they can be shaped and modified by early dietary experiences. Introducing veggies early and often is critical because beginning in the second year of life, children typically become more selective about what they eat. This neophobia or rejection of new foods tends to peak between the ages of 2 to 6. That's why eating veggies early and often is so important. I love making eating veggies fun with my girls by asking them to help choose vegetables we will eat when we go to the store, like carrots with the stems. We have also planted herbs and a few vegetables, although we haven't reaped the harvest yet. My girls and I have the best time in the kitchen, mixing, stirring, and exploring flavors. Everyone gets a turn to cook, and everyone gets a turn to taste. I am elated and so proud to partner with the Partnership for a Healthier America on the Veggies Early and Often campaign. Through the Veggies Earlier and Often campaign, PHA is convening leaders in the food industry, health professionals, and early care and education providers to consolidate evidence and outline an action agenda with the goal of raising a generation of veggie lovers. What an outstanding goal. To learn more about this awesome effort, the Veggies Early and Often campaign, visit ahealthieramerica.org. So before I go, I want to share another veggie song with you that I sing with my girls. We have so much fun in the kitchen and at the table. This one is called Sweet Potatoes Are Not Tomatoes. Sweet potatoes are not tomatoes, they're orange, not red. Sweet potatoes do not taste bitter, they're sweet. Instead, sweet potatoes I love to eat, baked or mashed, they're such a treat, and they all grow far, far down in the ground, underground, in the ground. Let's get those veggies early and often.
Hi, I'm Brittany Furrow. I'm the Vice President of Health and Sustainability for Ahold Delhaize USA Companies, and I'm happy to be here with you today. If you're not familiar with Ahold Delhaize, its US companies include Food Lion, Giant Company, Giant Food, Stop and Shop, and Hannaford. And for these companies, healthy sales is all about what % of their food sales support nutritious choices. And they bring this program to life through a nutrition standard called Guiding Stars. Guiding Stars evaluates all of the food sold by these companies and determines whether they earn a nutritional rating of good, better, or best. The best part about this program is that it makes nutritious choices easy for customers to navigate in an omni-channel environment. And for retailers like the companies of Ahold Delhaize, it makes it easy for us to make business decisions about what we put into the assortment to make sure that we're providing nutritious choices for our customers. Food retailers have a really large role to play in building health, and promoting healthy shopping is integral to the strategies of our companies. We set these targets to monitor, to demonstrate progress, and to really manage our business differently to build healthy communities. While we believe all families deserve nutritious choices, setting targets around healthy sales has brought more intention to how we manage our business and provide healthy choices to customers. Each of our local brands is thoughtful about their assortment and how it's curated to make sure that we have healthy options available to our customers. Specifically within our private brand products, that's our own product that we develop, it's created an opportunity for us to look for areas to reformulate and to work with vendors to help make the product more nutritious and earn a guiding star. We're also trying to stay close to our customer shopping preferences. And a lot of our customers are migrating towards an omni-channel experience, which means they're seeking information and shopping and purchasing, not just through our stores, but also through mobile devices, through .com, and all the different channels through which they can get information about food, nutrition, recipes, and meal planning. The companies of Ahold Delhaize have set ambitious goals around healthy sales. Specifically, we're aiming to achieve 54% healthy sales by 2025. And to break that down, we're really focused on our private brand products, our fresh, unbranded bulk produce. And I'm really happy to share that we're well on our way. We actually just reported 52.5% of our Q1 sales in 2021 were healthy. We've also taken an industry-leading position in partnership with PHA to really recognize the need for greater transparency around health in the retail and food system. So just last year in October, we announced a partnership with Ahold Delhaize to create more transparency around the overall food assortment and everything that's sold in retail, and what percent of that assortment is considered a nutritious choice. Current reporting shows that last year, just over 31% of total food sales came from products that met the nutritional criteria to earn a star within the Guiding Stars program. We certainly believe that this number is going to increase as bigger brands work to innovate and meet the demands of customers for more nutritious choices, and it highlights a real opportunity for us as an industry of retailers and CPG manufacturers to work together, not only to create this level of transparency, but to help improve performance on the percentage of overall food that meets a nutritious choice. Healthy sales and nutritious choices are really important to Ahold Delhaize and all of its brands. We're excited to be a part of the PHA community today and appreciate the opportunity to share. Guiding Stars, we believe, is a great program to help drive nutritious choices, and we're really excited for you to be able to learn more. Good nutrition doesn't have to be complicated. For 15 years, Guiding Stars' positive approach has used trusted science to set the standard that determines when a product has good, better, and best nutritional value. Look to us for essential data to improve product formulations, reward healthy behaviors, power recommendation engines, and keep your commitments to a healthier community. Guiding Stars empowers a healthier and more equitable food system. Guiding Stars, nutritious choices made simple.
Welcome back, and thank you for staying with us. Don't forget that conversation between Michelle Obama and Nancy Roman coming up in just a bit. PHA is proud to collaborate with the United Nations Food Systems Summit taking place later on this year. We recently sat down with UN Special Envoy, Dr. Agnes Kalibata, to ask the question and get her perspective on this very major global convening effort.
The Food Systems Summit was launched in recognition that we were not coming through on SDGs. Hunger has been increasing. We have added 60 million of hungry people in the last 6 years alone. Nutrition is going down. We know that obesity is now one of the major challenges and the major drivers of COVID itself. We are not doing well from a climate change perspective, and food systems is contributing 30%. So there are a number of things that are not going right. And amidst that, we also have now the COVID pandemic that has made things worse. So when the Secretary General launched the Food Systems Summit, he was hoping that we use the opportunity of the remaining 10 years, what we are calling the decade of action, to be able to deliver on the things we committed ourselves to as a world. The opportunity to end hunger, the opportunity to do better with regards to nutrition, the opportunity to look at our environment and reverse some of the damage that is being done, but also the opportunity for better livelihoods for people, as we now see, and as COVID-19 has shown us, we just are not doing well from a livelihoods perspective. And then the opportunity to build resilience and strengthen resilience for people that were already being affected by climate change. So really, the idea is that we use this opportunity that the Food Systems Summit offers to think through what we can do differently, to come up with different ambition, especially because we are running out of time. There are a number of things that I've learned from what we are doing so far in the food systems perspective. The biggest lesson for me is just how prepared people are for change, how ready people are for change. And I must say I didn't have that level of expectation when I started. And I also must say that maybe COVID has had a lot to do with it, but the realization is there, right there, that people do understand that we are impacting our planet in ways that are not sustainable, that there are ways to do different things differently. So the opportunity is right there. The second thing I've learned is people are actually excited about the type of dialogues they need to be having, but also understanding that this is a conversation that is complex and needs to bring in different institutions in countries, in governments, but also different players to be able to have conversations and be able to come up with solutions. The third bit is also the difficult part of having some of these conversations, because some people definitely, we are a world that is made of all these different groups, and some people look at other groups as the bad guys. and I don't necessarily believe that there are bad guys out there, but there are ways of doing different things that could be better, that could be different, that could be more appropriate to improving livelihoods in general and more inclusive. So I think the part that surprised me is just the fact that people really, there's very little trust in the system, and building that trust and encouraging those conversations to happen and being able to move forward together is so critical and so important. And these days I spend so much of my time trying to tell people that these are difficult conversations that we must have for us to be able to move forward. So right now in the Food Systems Summit, we have over 100 countries engaged in dialogues, having conversations around what we need to do differently. And what I like the most about these dialogues is how different sectors are being drawn together to have conversations around how they impact food systems, environment, health, nutrition people, agriculture people, people that are in charge of forests. These people are all talking together, having conversations. And I worked in government. I didn't see this a lot. But so the fact that this is happening is huge. So as we go into the Food Systems Summit and as we continue to have these conversations, I just want to encourage each of us to be part of those conversations, to engage. There are ways you can engage. You can engage as a food systems hero. Just sign up as a food systems hero so that you can have access to information. Go on to the food systems community website and engage there as well. Or talk to a friend who is a champion of the food system, or organize meetings if you're a champion in your network or you're linked to a champion, or find someone who knows about the food system. The biggest opportunity here is we all have an opportunity to engage. The Food Systems Summit is offering a chance for all of us to engage, and we should not miss it, because we need to understand that this is extremely important for us as people, but it's also important for our planet. And if we want to continue prospering, this is something we need to do. So I'm just encouraging you to be part of this conversation. Don't be left behind.
Thank you so much, Dr. Kalibata, for joining us today. Although PHA works on system change, it's like a thing we do. During the pandemic, PHA really stepped up to accelerate systems change in the area of fresh food access. Through the COVID-19 Fresh Food Fund, PHA has now distributed more than 2 million servings of fresh fruits and vegetables. I'd like to turn it over now to PHA board member Viviana Lopez-Green to have a discussion with this important work and talk to some of the program leads from our on-the-ground partners around the country. Viviana, welcome. How are you?
I'm doing great. Thank you so much. My pleasure to be here. And as we've been discussing, the COVID-19 pandemic brought enormous challenges. But with those challenges came insights and opportunity. And just to highlight that the pandemic spotlighted what PHA has known all along, that disadvantaged communities with limited access to nutritious fruits and vegetables are more vulnerable to the ravages of diet-related diseases. Unfortunately, those diet-related diseases, like diabetes and obesity, prove to be severe comorbidities to the COVID-19 as well. So in response to the clear need for access to fresh produce, to fresh fruit and vegetables, we established at PHA the COVID-19 Fresh Food Fund, a program designed to redirect fresh and high quality, but also excess produce into communities that were hit hard economically by the pandemic. In 2020 and 2021, we rolled out the program in 3 high-need cities, Denver and Aurora, Colorado, and Rochester, New York. We are joined today by our partners from all three fresh food funds. We have Christina Welsh, founder and CEO of the Co-op First in Denver. We have Mitch Gruber, Chief Partnership Officer at Food Link in Rochester. And we have with us also Kate Garvin, Director of Community Schools, Family Advocacy, and Community Engagement at Aurora Public Schools. Thank you all for being here. And I wish we'll have more time, but we would like to take your expertise and the work that has been happening to highlight how has this been happening in the ground. And Christina, we would love for you to share with us, and of course, Mitch and Kate, please chime in, but how has the COVID-19 Fresh Food Fund helped you meet the variety of challenges that arose from this pandemic?
Absolutely, Vivian. Thank you so much. So, you know, back in March of 2020, nobody knew what was going to happen. We knew things were shutting down. And as a nonprofit that traditionally turns lawns into gardens, fresh food access and education around fruits and vegetables have always been very important to us. So we had wanted to do a program where we could do school lunches for our underserved community of 96% free reduced lunch, knowing we needed to offset the food for these families. And this was pre-COVID that we were seeing, you know, families with this much need. And I remember getting the call in April from the USDA the very first week saying, you know, can you start this program early? The schools are closing. We need someone to provide food. And we thought, sure, we'll roll out with, you know, we'll serve 30 kids a day. We started that week. Our volunteers and chefs were on board. And within 3 weeks, we saw that that need was not, you know, 30 kids a week. It was closer to 300. And we had no idea how we were going to afford the fruits and vegetables. And we couldn't imagine giving them processed food or anything that would be contradictory to our mission. So we were really fortunate to be partnered with Partnership for a Healthier America. And I remember the day the first crate of boxes arrived and we opened it, and it was a plethora of fruits and vegetables, fresh raspberries, blackberries, tomatoes. And we quickly realized this was so much more than, you know, school lunches, but this was enough food to provide meals for 5 days to 7 days for a family of 4 to 6 people. And, you know, we were elated to be able to support. Our families had so much need. There was transportation issues. There was being able to watch the kids, and also internet. A lot of our families didn't have that. And there was another partner, Zapongo, who was amazing in providing recipes in the boxes of produce so that families could have ideas of what to use with it, but you had to follow a link. And so many of our families didn't have access to internet. So we spoke with PHA and we were able to start empowering our local chefs who were out of work, which was a really amazing part of the partnership for us. Was we were able to start creating vegetable forward pre-made meals, and we got to incorporate culturally relevant recipes for our neighborhood. So each week we included these recipe cards that, you know, introduced the chef. It had the recipe in both English and Spanish, and was really able to not only feed so many families in need. By the end of the pandemic, we were feeding 550 families a week. You know, so feeding so many families, and we just really appreciated the support.
Wonderful. And Kate, would you like to share some of your highlights on how have you been meeting the needs of the community?
Yeah, so similar to Christina's story, when the pandemic hit, we were, you know, looking, I run a network of community schools. And so we're a hub of the community, and we are often in relation to our families. And when the pandemic hit, we were like, what do we do? How do we continue to build our trust and be there for our families? And my team was able to conduct over 6,000 virtual home visits. And we learned just so much the need of not only food, but fresh food. Our families were accessing different resources, but we were really struggling to find those fruits and vegetables. And so that's really where PHA came in for us and the Fresh Food Fund to really start to think about how we as schools can be part of the solutions as well. And so we were equally as excited to open up those boxes and to be able to provide over 1,100 boxes for the last 17 weeks within Aurora. So it's been quite a pleasure to be a part of the work.
Thank you, Kate, and thank you so much, Christina. One of the goals of the Fresh Food Fund is to build long-term access to fresh fruit and vegetables in disadvantaged communities. And Mitch, could you share with us what opportunities do you see for food retailers to bring greater quantities of fresh produce into these communities?
Absolutely. And I'm even going to link my answer to the last question too. You know, FoodLink is actually, we're the Feeding America Regional Food Bank in Rochester, New York. And we serve, millions of pounds of food out of our doors on a regular basis, even before the pandemic. And certainly during COVID, between the USDA's CFAP boxes and in New York State, there was a great program called Nourish New York. Our traditional food banking got a lot of support from government sources. But FoodLink has always prided ourselves on thinking about the root causes of hunger and not just utilizing the Band-Aid that is traditional food banking. And so we, over the course of the last 7 years, have developed one of the biggest mobile market programs, truly a mobile farmers market that loads up fruits, vegetables, eggs, goes into underserved communities where there's not a lot of fresh food retail and sets up shop. We had to close during COVID at the beginning parts, and all this relief and support we got from government sources was focused on the charitable side of things. PHA and this Fresh Picks program really allowed us to think through how to reopen our curbside market. And that was hugely important. There were so many people in our community, I'm thinking in particular about seniors, who maybe didn't need to utilize emergency or charitable food, but had a major barrier to getting to traditional retailers. Not just because our public transportation system wasn't what it used to be, but also because they were being told by their medical professionals not to go out to the store. So I think it's critical, to answer your question, Viviana, it's critical that we think about food retail in more innovative and creative ways. Mobile farmers markets are really an important method to think through what we take out of COVID and extrapolate to be always omnipresent solutions to issues with food retail. And working with PHA, utilizing Fresh Picks and pre-packed boxes to be able to re-energize our curbside market in a safe way was hugely important. And our curbside market is now back to almost full strength, and the community is really happy with it.
Thank you, Mitch. And Kate, could you share a little bit about how did you get the word out? You started your the answer about your program, like being a trusted partner of the community. How, with everything, the circumstances that were created by the pandemic in these communities, could you share a little bit about what was the response of the community, where we are trying to make sure that they were getting access to, fruit and vegetables and in a different way? It would be good, I think, to learn how did you all get the word out?
Yeah, sure. I'd almost flip your question on the head and say the community brought it to us. And really, we've been able to develop those systems for the community to really communicate out their needs. We in our schools believe that our children have to be healthy for them to be able to learn. And so we were well positioned pretty pre-pandemic with Children's Hospital and different nonprofits in the community, that we were able to take this data that 80% of our families were expressing this need and work alongside other partners and think differently about how we could really come together and bring fresh fruits and vegetables to the community. And so when we partnered in with PHA, it wasn't necessarily us doing outreach to the community, it was informing that we were responding to the needs of the community. And now we're working deeper with parents and families in those nonprofits, and we're actually opening up food clinics within 2 of our schools, where our families are going to be able to come in and talk deeper about their relationships and their needs within the community, and learn about all of the different resources beyond just our fresh fruits and vegetables that we're able to hand out now, and hopefully move into those places of food kits and really allow the community to drive the bus on what they want. And for us, you know, our schools, we have over 75 home languages. And when we start thinking about food banks and distribution of food, fresh food and fruits and vegetables, those are the most culturally relevant foods because anybody can cook what they want out of it. And so to us, that's really the key for us, is making sure that not only is our families getting healthy food, but foods that they're going to use and that will actually support them in their journey to food security.
Christina, Mitch, any?
Yeah, I'd be happy to chime in on that quickly. So I talked about how our program was focused on our mobile farmers market.
Right.
Most of our sites that we served through the partnership with PHA was large, affordable housing communities and complexes. And the way that we really spread the word is something that we do throughout the year with our curbside market. We develop, well, we have curbside market ambassadors. There's a few people in every building who are just so thrilled to have the opportunity to be able to shop. Our curbside market is also one of the only places in Rochester where people can actually use double up food bucks. So SNAP benefits get 100% of an incentive. And so we find individuals, members of the community, to really champion our work, get their neighbors out there, encourage people to shop, encourage people to use the recipe cards. And that is true of everything that we do. We are only as strong as our biggest ambassadors and champions in the community. We had some incredible ones for this program.
That's wonderful. Christina?
Yeah, the same thing. So we are in a low-income neighborhood, and we created a year-round farmers market that empowers local producers and farmers. And so we've been able to shift the PHA boxes to now be more like a community-supported agriculture where families can use SNAP and double up bucks to purchase the same foods year-round that they were receiving for free at the height of the pandemic. So it's been a really wonderful program and really increased our SNAP enrollment in a state that's 48.
Wonderful. So any changes, any learnings from the ways that you all have to change the approach of getting this to the community that you think will change your services, your business model after this?
I'm happy to jump in and get started with that question. So for us, you know, I've always had an inclination that our program works best when we offer people choice. And what we were doing with this program was a pre-packed box. And so I was skeptical from the start about offering people things that are pre-packed. And the truth is that we were able to learn lessons that there are plenty of people that choice is important. And we know we're going to continue to have choice, but we're going to also incorporate the pre-packed box shares. It's easier for some folks. In particular, we found that senior citizens really enjoyed this. And so we're going to use the lessons that we learned, champion it with ambassadors, find the right sites to have pre-packed boxes, but not rule it out. And that's something that I really give PHA a lot of credit for encouraging us to do.
Wonderful.
I can hop in, and you know, something we've just really learned and has been highlighted through this work is just cross-sector partnerships, and really going beyond who we typically work with and start thinking about, let's put the community at the center and figure out how to get food there. And whether it's at a school, whether it's at a food bank, how can we all work together to actually solve the root problem rather than all trying to take on little pieces of it and not really getting anywhere. And so really just learning how we can all work together in a different way to serve is a big outcome for us.
Absolutely. Like Kate said, leveraging those community partners. One of the big hurdles for our community was transportation. We were donated an electric bicycle, so it's been really fantastic to have multiple options to get these food to families. And it's just all about listening to the community and really understanding what the need is and the best way to support.
Well, thank you so much, Kate and Christina and Mitch, for everything that you do to bring food equity to your communities. As Tommy shared before, this last February, I think we surpassed the incredible milestone of 2 million servings of fresh food and vegetables through this COVID-19 Fresh Food Fund. So kudos to that. And then we know that the need is great. We know that the work needs to continue. At PHA, we are looking forward to continue our partnerships. Thank you so much.
Thank you.
Thank you.
Mochi, want to know what time it is? Yeah, it's dance break time. Hey, everyone, get up and take a stretch. Come on, Mochi, let's dance.
With Waffles and Mochi.
On behalf of everyone at Novo Nordisk, we're honored to be in our 9th year working with the Partnership for a Healthier America. We're about driving change for people with chronic diseases, including obesity. That's because nearly 100 million Americans live with obesity, which is linked to heart disease, diabetes, and severe cases of COVID-19. Education around nutrition and exercise and having access to treatment options are equally important. We're so proud to stand with PHA in this important mission, and we wish you a great summit.
A very special thanks to Novo Nordisk for such strong support of PHA's work for so many years. PHA would not be the same without your partnership, and we're so grateful for your support. Also, wow, Waffles and Mochi have some super fun dance moves. I hope you got up, hope you got your stretch on, because we are in for a total treat. PHA's president and CEO, Nancy Roman, sits down with PHA Honorary Chair and former First Lady of the United States, Michelle Obama, for a wide-ranging conversation about food equity and passing the love. They cover the world in a very short period of time, kind of like our friends Waffles and Mochi do in their Magic Cart.
First, I just want to say thank you for having this conversation, and thank you for just what a fantastic partner you've been over these 10 years plus. So amazing, so much fun. And this last chapter has been particularly fun with Waffles and Mochi. And I just wanted to ask you about the inspiration. Like, how did you decide to do this?
Well, we were actually approached by the co-creators of Waffles and Mochi. They came to us through our production company, Higher Ground, working with Netflix. And the minute I saw the concept of puppets and food adventure, I thought, well, this speaks directly to all the things that I've been working for and with through PHA for the last decade or so. It just all made sense. The notion of, going into people's homes with their kids and finding ways to have fun exploring foods and teaching kids how to cook and bringing families together around food. I mean, it's all a part of what we need to do to, have better nutrition in the homes and better education around food nutrition. But at the same time, we were in the middle of a pandemic, and we know that this pandemic has not affected families equally. And we are seeing the effects of the food inequity in this country, where families are going hungry because they're out of work, they don't have access to the food that they need because it's not anywhere within walking distance. So we thought, well, if we're really going to have this kind of conversation in people's homes, we've got to make sure that every family can participate. So we had to start thinking about using this platform to raise awareness and to bring some solutions to this problem. And that's when we thought about the Pass the Love campaign and partnering with PHA. It was just a natural sort of next step in the work that we're doing. And I'm grateful to PHA for always being willing and able to step up to these interesting challenges and ideas and opportunities that we have to work with Netflix and Waffles and Mochi. So it's just been a natural next step in the work that we're doing to make sure that families out there who are hungry and don't have access to food get the support that they need and can participate in this platform, Waffles and Mochi, with their children in a way that makes sense and it's affordable and teaches nutrition as well.
Yeah. Yeah, well, we're definitely going to dive into some of that. And one of the things I love about the show is just kids going on their own adventure. And one of the things I remember is, gosh, just how hard it was sometimes to get my kids to try something new, like a mushroom or a tomato, even a tomato. You've shared that, you know, you were a picky eater as a child, and I'm just wondering, when did that change, and why did it change?
Yeah, no, I think I was like most children. You know, we have to remember that, you know, we come to this earth, we're born to this into this earth with, you know, limited taste buds. It takes us time for those things to develop, and we have to remember that it takes a level of patience to let a infant grow up into a child, into an adult, where they, you know, are more open to different foods. And I was no different. You know, I only like peanut butter and jelly for breakfast for most of my life, I think, until I went away to college. And the same is true for my kids. You know, there's a reason why kids only like certain textures and flavors, and they'll only eat white food. I mean, there are some protective, you know, issues that are at stake for kids and trying new foods. The one thing that I just tried to remember with my kids, and I saw with my mom, is that you got to be patient and just give them some time to mature and develop. But one thing that my mother never did was she was never a short order cook, you know, and that was generational. I think that that's some of the mistake that modern parents make, because we try to do everything for our kids. We're afraid that they're going to starve. Well, that was never the issue. In our house, dinner was prepared and you ate what was on your plate. And what happened, because my mother wasn't into cooking for every taste bud, is that we had to try whatever food was given, and so that developed our taste buds over time, so that by the time I was a young adult and out in the world, I was used to trying different things, and found things that I never thought that I would like enjoyable. Brussels sprouts cooked properly, okra, vegetables that were slimy and yucky are now like terrific, and I see that in my own daughters. Because they were required to try some things, not out of punishment, but just out of this is what we're eating. They're much more adventurous eaters than I was, even at their age. I mean, they eat raw fish, they love sushi, they love edamame, they love foods that I never knew existed. But they were exposed early on, and I didn't give them the option of eating whatever they wanted whenever they wanted. They had to eat what we were eating as a family.
Yeah, my kids still can't believe we ate liver on a regular basis.
Oh, we did too. And now we talk. That was the worst day of the week, liver day. We usually, it wasn't weekly. It was like once a month. My mother would make liver because my father liked liver.
Yeah.
We had said he had taste buds like an old, like an old shoe. He'd eat it if my mother cooked it. But liver was definitely one of those
it was one of our regs too. Well, another thing I love about the show is it's all about the joy of food and the adventure of food and the discovery of food, and not so much about the health of food. You know, I like to say health kind of shimmies in through the back door. So talk a little bit about that approach.
Well, it's been our approach from the very beginning. When we started Let's Move in the White House, it was more about carrot and less about stick. That, you know, a lot of people, you have to learn to meet them where they are. And if you're talking about something as personal as food, you know, we tried very hard not to be judgmental about it. That by encouraging people with fun and light and optimism was oftentimes a better approach than eat your peas kind of thing. So That's why we planted a garden, because what a better and more fun way to talk about the importance of vegetables than actually getting kids in the dirt, planting and watching something grow. They'd be more inclined to eat it. And the same is true with Waffles and Mochi. I mean, the whole underlying philosophy of Waffles and Mochi is that there's no judgment. You'll see in each episode when it comes to each food, there's never a good or bad about it. It just, a mushroom, what is it? Well, let's explore it. And try it if you want to, but this is what it is. And yeah, it's kind of funny and it tastes different in your mouth and it looks a little scary, possibly. But you know, it's all done with a level of humor and a lack of judgment about, you know, certain foods being good or bad. That learning will happen naturally with kids over time. So Waffles and Mochi is just, you know, one of the reasons why I was attracted to the concept is that it mirrored what we believe to be true when it came to getting kids to eat healthier. That if you can make them laugh and take them on an adventure and have a little fun with it, that's a better way than a lecture or forcing kids into something that they're hesitant about.
Yeah. So right. I think we have to thank you for that, because I think in the public health space, we've been slower to come around to that way of thinking. So important. You know, the charitable system's doing so much good work, but it can't do it all. And it's just not sustainable. And so if we want to really use food as a tool to bring health equity, we have to have healthy, affordable food for sale in every single zip code. And I know you've been a big champion of the private sector and you understand the critical role they play in the food system. But I want to ask, do you think they're doing enough?
It's a great question. And first I have to commend PHA on your constant, persistent efforts to eliminate food deserts and address these inequities. You're doing a phenomenal job, and you're doing it with a number of amazing private sector partners, many of whom are working on the Pass the Love campaign, Walmart, Blue Apron. So many are stepping up, and they've been phenomenal partners throughout the year, or throughout the many years we've been working together. But no, we have a long way to go. We have a lot of work still to do, and in order for that to happen, we've got to have more partners. We have to have more of the private sector stepping up. Look, I grew up in a predominantly Black neighborhood, and I wrote about my book that at a time in my life I saw the community change. You know, a community that was vibrant, that was racially diverse, that had grocery stores and options for people within walking distance. And then as white flight happened and those neighborhoods went from being mixed to predominantly Black, we saw grocery stores moving out, big chains deciding not to locate in grocery stores. And so the whole notion of being able to find fresh produce and make a healthy meal every night became less accessible in communities like mine where I grew up. You know, a family can't have to get on a bus or have a car or take a cab to get a fresh head of lettuce or a nice ear of corn. But sadly, as those grocery stores left communities, all we were left with was, you know, small chains or fast food, and that's the diet of so many people in communities like mine. Look, when you walk into a Walmart, there are aisles and aisles of food everywhere, varieties of cans and boxes. And so in this country, we have enough food. There is no reason why people shouldn't have access to food. There's enough of it to go around, an abundance of it. In some neighborhoods, they have more than they can manage. So in order for us to make that shift, we've got to have partners in the private sector, food retailers, food manufacturers who are thinking creatively about ways to get all of that food to more of the families that need it. There has to be a way to do this. We live in a society where cars are driving without drivers. Packages are being delivered without people. I know that if the private sector really put its head together and thought through how to take this abundance of food and get it into the hands of more families in this country, that we could do it. But we've got to keep putting pressure on them. We've got to keep encouraging the partners who are here at the summit to reach out to their competitors, even to the people in their networks, and to urge them to step up and find a solution. Because in the end, as I always say, look, a grocery store is only a grocery store if it has customers. And if the customers aren't healthy and they're dying off early, you know, that's your customer base, if you want to be as crass as that. You know, I think the private sector has an invested interest in making sure it has a healthy consumer base on which to build. And we won't do that if people are dying early because of obesity and diabetes and health issues that are avoidable and preventable with good prevention, good nutrition, good access to health care, all of it. So yes, we need our private sector partners to step up and do even more, because we can't do it alone. PHA, we can, you know, have all the wonderful campaigns in the world and raise awareness, but we've got to reach the people who have access to the food and who are in the business of bringing it into our communities, and we need them to work hand in hand with us to solve this problem in this country.
Absolutely. And as you say, if we continue to tolerate this, it's a choice. If we continue to have a two-tiered food system, it's a choice society's making. And one of the reasons we're collecting the data that we are through Pass the Love about how do these meals compare in taste and price to fast food is because that's going to be the competition. We see a future where these meals could be for sale at the same price as fast casual.
Absolutely.
And this is a doable thing. We know what to do. It's not like carbon sequestration. Turning maybe to a lighter subject, and I'm tempted because I could go off on that for a while, so I'm reining myself in here a bit. That you know, when you look to the future, whether it be the future of food or just the future of the world more generally, this beautiful, complex, difficult, challenging, glorious world that we live in, what gives you hope?
You know, the same things that always give me hope, and it's people. Because too often we see people not doing the right things, but that's not the whole story. I mean, in communities all over this country, rural, urban, black, white, brown, what have you, of all religious sects, people are doing the right thing. They care about each other. If they know that this issue of food inequity exists, they care, and they do want to step up, and they do want to see their neighbors eating healthy. There is a level of empathy that exists within all of us that keeps us moving forward. And sometimes we don't see it in the news, we don't see it in TV, but if you've had the opportunity to travel the country like I did, like my family was able to for the 8 years we were in the White House, that you know that empathy is there. You know that compassion and that desire to step up and help others is there. And that's why we can do the Pass the Love campaign, because we know that when most families go up to that grocery store line to check out their groceries and they're told that they can feed a family with a small donation, most of them will. You know, people would be willing to make sacrifices if they knew that the issue existed, if they really understood the level of hunger. Sometimes it's hard to know in the comfort of your own community, not to say that everybody's life is easy, but when things are okay and you're feeding yourself and your family is good, that's the goal. That's what you're waking up trying to do every day. sometimes you don't have the time to really understand the challenges that may be going on in the household right across the street from you, down the way, in the same cul-de-sac. It's hard to believe that there are families out there that struggle day to day just to put food on their tables. But when we educate the nation, when we give them the information and we give them clear tools on how they can help and what that sacrifice looks like, people are ready to step up and do it. That's why the work of PHA is so important. You know, we have to continue to educate people on this issue, that in America, in 2021, there are people going hungry in a world that is full of food and abundant, where crops are going unharvested because of some economic decision that's being made. When people understand that that issue is happening and they're told this is what you can do to help, they tend to step up. And that gives me hope that we have to keep doing the work to educate people so that they know that the issues are out there and that there's a clear way that they can make a difference. And young people continue to give me hope because they're the ones that are watching Waffles and Mochi, and they're seeing things differently. They're learning from our mistakes. They're better informed. They're less picky eaters because they learned that a tomato is a fruit and a veggie, because a little pink mochi ball made them think to try a mushroom. You know, it's the creativity and the of shows like Waffles and Mochi and the increased access to information that kids are getting at an early age. They are benefiting from that, which means that they're gonna grow up being more mindful and more aware and more educated, so that when they raise their kids or go to college or take on the next generation of jobs, they're bringing their experiences to the table. That's where change happens. It's generational. And it's frustrating to think in those terms because when issues are real and right today, you want to solve them today. But a lot of the work we're doing is laying the foundation to make this next generation healthier, more educated, better aware, and equipped with the tools to solve the problems. That's where hope comes from for me.
Well, I'm hopeful because you're lending your voice to this, which makes a huge difference, and our partners are stepping up. Well, thank you so much for your time. You've been such a rock star for this issue, such a great supporter of PHA. So many times young people tell me that they were inspired by you during those years in the White House to give their whole lives and careers to these issues we care about, using food as a tool for health. So I can't really say how much we appreciate it, how important the work is. And we have to keep leveraging it and get to a better place.
Absolutely. And Nancy, let me just thank you and the entire PHA team. There's no way that we could still be having this kind of impact without the work of your organization. And you have lived up to everything that I could have hoped that PHA would be in the world. I know there's a lot left to do, but I think everyone who is within earshot of this conversation should be proud of the work that they're doing. So thank you, and thanks to the entire team.
A great conversation between Nancy Roman and Michelle Obama about the awesome work of PHA. Before we get back to working on creating lasting systems change, or maybe just binge watching Waffles and Mochi. By the way, the first episode of Waffles and Mochi, Tomatoes, available right now for free on the Netflix Junior YouTube channel. That got announced today, so tell your friends. And we have one more exciting thing to share with you. On Monday, PHA and Mrs. Obama announced the first Pass the Love partner cities, Cleveland and Atlanta. In total, PHA is going to distribute nearly 400,000 healthy meals to both cities combined. And here to share more about that awesome news is the chair of PHA's board of directors, Peter Dolan, along with some very, very special guests. Peter, you've got a great crew joining you today. This is awesome.
Well, thank you. I'm Peter Dolan. I'm the chairman of the board of PHA. I've got, as you said, I've got a terrific panel here with me today for this really important milestone, launching the first 2 cities of PHA's Pass the Love campaign. Back in March, PHA, along with Higher Ground Productions and our honorary chair, Michelle Obama, set a truly bold goal. 1 million meals distributed through healthy meal kits to families in need, all inspired by Waffles and Mochi. Our goal is to reignite the joy of cooking and preparing meals at home. Today, we begin that effort in Atlanta and Cleveland, where during our campaign, we'll distribute nearly 400,000 meals to families in need. I'd like to introduce you to our key partners in this effort. From Atlanta, Mayor Keisha Lance Bottoms, and a special shout out hello to her mother, who we know is watching today. John West of the Atlanta Community Food Bank, and from Cleveland, Eric Gordon, CEO of the Cleveland Metropolitan School District. Welcome to all of you, and congratulations on this new development for your cities. First question for Mayor Bottoms. Hunger and nutrition insecurity have been spotlighted throughout the pandemic. How has your city grappled with these issues? And tell us, what will this program mean for Atlanta families?
Well, first of all, thank you so much, Peter. It's such an honor to have Atlanta named with Cleveland for this Pass the Love campaign. So the work is needed. We knew that going into the pandemic, but as with the rest of the world, we had to change course very quickly. Namely, dealing with our students who are enrolled in our Atlanta public school system. Atlanta is a little different than some cities in that the city government does not oversee the schools. They are a separately elected school board. But that being said, obviously our children matter, and it's the responsibility of us all. So we immediately transition our parks and recreation employees, many of our other city employees, to serving meals to kids who normally would receive their breakfast and their lunch at school. Otherwise, they may not eat. And also the kids that we would normally service in our after schools programs in our community centers. We delivered over 119,000 meals over the course of the last year. And partnerships have been so incredibly important to us, including our seniors. And so what has been almost the worst of times in so many ways has given us an opportunity to really rise to a level that I think Dr. King would be proud of, as he talked about the beloved community that we know he dreamt of creating. And we saw that in action over the last year.
That's great. Thanks. One follow-up question for you, Mayor. As clearly as a mayor of a major city, you've got a complex agenda with lots of priorities. How do you think about food equity as part of the agenda for your administration?
Oh, it's a top priority. We created what we call a vision of One Atlanta, and it really was based upon Dr. King's dream of this beloved community, one absent of poverty, hatred, and prejudice. And so in Atlanta, with our public schools, roughly 68% of our kids receive free and or reduced lunch. We set a goal of having 85% of our residents within 1/2 mile of access to fresh food. And we know that when your body is not healthy and whole, your mind is not healthy and whole. And so this is work that, even when we're not in the midst of a pandemic, is important. But given what we are facing with COVID-19, it's become even more important for us to continue this work.
Well, thanks so much for your leadership in this area. Let me go to Eric Gordon, who is the CEO of the Cleveland Metro Schools. You know, when we think about this in Cleveland, this distribution is going to coincide with summer break, when most kids are at home, even before COVID, and don't have the same connectivity with schools and school meals. So how does Cleveland plan for this, and how will this program contribute to feeding children and families in Cleveland?
Yeah, thank you so much for including us with our sister city, Atlanta, in the launch of the Pass the Love campaign. Cleveland is both a city that has real need to address food scarcity and real civic will to do that. And that's why the schools are so important. Unlike Atlanta, 100% of my children get free breakfast and lunch at school because of our poverty. We have the highest childhood poverty in the nation. So food distribution, particularly in summer when school is out of session, is not new to us. Last year, during the pandemic, we had both daily and weekly pickups and shuttle service. We provided produce and dairy boxes in cooperation with the USDA. We partnered with our Cleveland Community Food Bank to distribute backpacks for weekend meals and with Children's Hunger Alliance to provide suppers. This summer, we're going to have 40 sites running all summer long to provide breakfast, lunch, and supper, as well as feeding 21 student athletic groups so far. They're still rolling in. And these boxes are going to help bridge the gap for families trying to stretch their food dollar while simultaneously helping us to continue to teach healthy food and meal preparation. So we're really excited to be a part of this with our city and with our community partners up here in Cleveland as well.
That's great. We've heard the word sustainability several times throughout the summit today. And a big emphasis of this program is getting families cooking together, but to build lifelong habits. How does that fit in with Cleveland Metro Schools curriculum and existing programs that you already have?
Well, this fits really nicely with our 2-gen programming, which is having our students and parents be learners together and be engaged together. And so having the games and the badging and that Waffles and Mochi platform, having kids cook together with their parents and learning those healthy skills together fits really nicely as part of our ongoing family and community engagement. It also fits with our formal curriculum where we have an executive chef on staff to make sure that our school meals taste good, and our dietitian and others who actually teach programming around healthy nutrition throughout the year and into the summer as well. So it's a really nice fit for what we're already doing here in our schools.
Great, that's terrific. Thanks, Eric. Let me bring John West into the conversation here from the Atlanta Community Food Bank. PHA has a robust history of working with food banks really throughout the country. We all saw early on in the pandemic the long lines at food banks around the country, but we're now seeing persistent demand, and food banks are doing really heroic work to step up to meet this demand. What are the needs you see at present in Atlanta and at the Atlanta Community Food Bank?
Great question, Peter. And I'd start by using the same word that you just used there, persistent. Over the last 12 months, the food bank here in Atlanta has distributed enough food to provide over 100 million meals to people in our community. And I think that level of need, almost a 40% increase versus what we were seeing pre-COVID, has been replicated across metropolitan areas across our nation, unfortunately. And we are continuing to see that level of increased need even now. The last couple of months of our distribution, for example, are some of the highest 2 months that we've seen in that 12-month period. So certainly it's persistent. I'll use another P word here, but it's prevalent. There are not communities, very few communities have escaped that increase in demand that we are seeing being driven by the economic impacts of COVID. So no matter where you are, no matter who you are, odds are you've got a neighbor, you've got a friend, you've got a relative who has found themselves in a place where they're in need, where they are in need for the very first time. And then that I'll use some continued alliteration. I'll make Eric and his team happy about that with saying it's proximate, right? So we're a lot closer to people who are in need maybe than we felt like we were a year ago, right? So many of us are only 1 degree removed, maybe one check removed, right? One crisis removed from ourselves or our families, finding ourselves in that place of need as well. So our communities continue to see increased need here in Atlanta and across our nation because of that.
And you talked a little bit about this, but what else can you tell us about the landscape of hunger and nutrition in the communities that you're serving? And where do you potentially see this going post-COVID?
That's a great question, right? So those two issues, hunger on one side and nutrition on the other, they're so interconnected. And you can really get a sense of that if you think about the types of choices and trade-offs that a family or an individual has to make to make ends meet month to month if they don't have enough food, right? So the very first thing that often happens in a household, and if you put yourself in the place of a parent who's trying to figure out where that next meal is coming from, one of those very first trade-offs that people often make is they buy lower quality food, right? Less nutritious food in order to make those dollars stretch. Can I just get enough calories for myself, for my kids, for my family to continue to help us make ends meet? And so that trade-off, that automatic trade-off that suddenly pops up, right, where people have to make a choice between having enough food and having the quality of food, the nutritious quality of food to help them and their children thrive and grow and have the kind of lives that we all want for ourselves and each other. That's the sort of trade-offs that we see with this issue and that we've seen replicated and really broadened here in the COVID response period. So partnerships like this one with PHA, partnerships like this involving Pass the Love, where we're able to work to have an influx, an injection, if you will. We're all talking vaccines, right? So an injection of high quality, nutritious food helps the food bank here in Atlanta achieve our mission, which isn't just to provide a quantity of food, not just to fill a void, but really to provide the quality of food that helps our families in our neighborhoods thrive the way we all want our own families to thrive. So we're excited about that partnership. And we think partnerships like this are really the future of how we continue to respond to these types of elevated need moving forward.
Well, that's great. And I can tell you, we're excited about it too. We're excited to work with all of you on this program. Let me thank Keisha and Eric and John for being a part of this panel. Let me thank you for all the important work you're doing on this issue. Throughout the summer, PHA will be making more announcements about other communities beyond Atlanta and Cleveland to join this campaign as we work toward our goal of 1 million meals distributed to families in need. We can still use your help. Every dollar raised today by clicking on the donate button will help bring healthy meal kits to families in need. I've been working with PHA as a board member since its founding, and the work you've seen here today has just scratched the surface of the amazing impact of this organization. I'd encourage all of you to keep in touch with our team, to engage with us for new partnerships and ideas, and to stay tuned for even more work and developments in the months ahead. To our audience around the country and globe, thank you for tuning in for this exciting announcement today. Now let me turn it back to our MC for some closing remarks, along with a few final messages from our important partners.
Thank you, Mr. Dolan, and thank you everyone for being part of today's incredible program. Thank you so much for watching and for joining us today. Big thanks to our sponsors as well: Novo Nordisk, Guiding Stars, Bayer G4A. Thank you so much for enabling such inspiring convening and content today. And as I would like to also say a big thanks to the Pass the Love inaugural partners, Walmart and Blue Apron, along with Pass the Love sponsor Bounty. We are so grateful for your commitment and for your support to help bring the joy of waffles and mochi along with healthy meals to communities around the country. I'm Tommy McFly in Washington, D.C. Thank you so much for tuning in today. Please be sure you visit wafflesandmochi.org if you want to help PHA pass the love to families in need. And as we wrap up, I hope you'll enjoy a few messages from young people cooking today. And I'm not saying it's a Marvel movie, but you probably should watch all the way through to the end of the credits for a special surprise. Take care, and thanks for joining us.
In the hidden world of waffles and mochi at Walmart, your phone is a portal to an amazing world of adventure. Smash the tater, crack an egg mystery, make silly pickled animals, and earn donations to the Partnership for a Healthier America at walmart.com/wafflesandmochi.
Unlock a better way to wellness with Blue Apron.
Step 1, make the marinade and feel the stress of the day subside. Step 2, enjoy quality time with quality ingredients. Step 3, develop new skills to take your cooking to the next level. Step 4, make an incredible meal you can't wait to share.
Discover all the benefits of home cooking with Blue Apron's 360 approach to wellness. We're excited to support Partnership for a Healthier America's Pass the Love with Waffles and Mochi campaign.
Do
Do you remember when we explored foods and ingredients with our food explorer friends, Waffles and Mochi? Yeah? And we made fried rice, and then we did all that fun activities with salt. It was fun, huh? Today we're gonna focus on the most important ingredient. Do you know what that is? It's love! It's love! Let's think of some things we can do to show Grandma how much we love her.
Call mine. I miss so much, mine. I miss you. Get sour.
Such a good job for Grandma. Mrs. Obama and the Partnership for a Healthier America are launching a new campaign called Pass the Love with our friends Waffle and Mochi. They're going to raise funds to provide 1 million meals to families in cities with the highest level of child poverty. To learn more about the Pass the Love campaign, visit wafflesandmochi.org and be sure to participate in the badge challenges by downloading the badge coloring sheet.
Kobe, what's the most important ingredient in every meal?
Love.
That's right, and Mrs. Obama and the Partnership for a Healthier America have launched a new campaign, Pass the Love, with a goal to help 1 million families in need. Waffles and Mochi are going on an adventure to explore ingredients all while passing the love. So, Kobe, how are you passing the love with today's badge challenge?
I'll be Mama.
And what are we making?
Mama, see. Bye.
Good job!
Oh, Mama. That's it.
Can you help pass the love? Visit wafflesandmochi.org to learn more about the Pass the Love campaign and their goal to feed 1 million families in need.
Bye-bye.
The most important secret ingredient in every meal is love. Mrs. Obama and Waffles and Mochi, along with the Partnership for a Healthier America, are launching a new campaign called
Pass the Love Campaign.
The goal of the campaign is to feed 1 million families. Just like Waffles and Mochi, today Kate is going to show his love for his family by helping set the table before dinner. Thank you. For Daddy, yes. Okay, let's set your seat now.
I need fork.
Good job. Thanks for setting the table, bud. Thanks. All right, which one's the love sticker? Make sure to follow Waffles and Mochi on their food adventure, only on Netflix. You can also have your kids print out this cool coloring sheet at wafflesandmochi.org. That's where you can also find out information on the Pass the Love campaign.
100. Okay.